is now currently set to be recorded. So thank you again for joining us today on this webinar on the topic of National Hispanic Hepatitis Awareness Day. With that said, I'll quickly introduce myself. My name is Tony Ochoa. I'm with the Latino Commission on AIDS, and I currently work mainly directing National Latino AIDS Awareness Day, which takes place every October 15th. But being that both NLAD and NHAD are modeled under a very similar mobilization model, I'm kind of working with our Capacity Building Assistance Division on spearheading the execution and implementation of NHAD this year. So again, thank you for your interest and participation in this webinar. And that's a little bit about myself. My email and our phone numbers here are listed on the slide. So if any of you want to reach out to me and contact me for any support or any help you might have, we'd be more than happy to exchange dialogue. So a little housekeeping just to kind of, so that we're all on the same page as far as how the webinar functions, is the lines are all currently muted. For those of you that are a little shy and don't really feel like talking, that's completely fine. You'll see on your screen somewhere there's a chat box. So feel free to use the chat box as a means of communication if you find that more useful than having the phone conversation. If at any point you want to unmute your line, you can do so by pressing *7, and then you can mute your line again by pressing *6. So I currently have the lines all muted now, but at any point you want to ask a question or whatnot, feel free to do so, and you can do so by pressing *7 on your phone. So what I'm going to do now is I'm going to go ahead and unmute the lines, just because I want to hear everyone that's on the call with us. And if you can, just go ahead and give us your name, your city where you're located, your place of work, and your position. So, and again, it has to be, there's about 20-something of us on the line now. So,
the conference has been unmuted.
I introduce myself again, Tony Ochoa here in New York City. I work with the Latino Commission on AIDS, and I'm currently working under the Capacity Building Assistance Division, spearheading National Latino AIDS Awareness Day and National Hispanic Hepatitis Awareness Day. Feel free to jump in at any point and introduce yourselves.
Good afternoon. My name is Courtney Smith. I'm in Houston, Texas, and I'm with the Real Talk Project Incorporated.
Hey, Courtney.
Hello, this is Javier Ortega from Santa Barbara, California. I'm the NHHAD Hepatitis C Program Coordinator.
Hey, Javier.
Hello.
Hi, good morning. My name is Francisco Nanclares. I work in San Francisco, California at the Alliance Health Project, and I'm a counselor and case manager in the substance abuse program.
Oh, welcome.
Hello. My name is Hello.
I'm Sandra. Yes.
I'm sorry.
Hi. I'm
My name
Sandra
is
Clark.
Thompson. I'm in New Orleans with I'm the program manager at Advocacy House.
Welcome.
Hi, I'm Jen Shockey with UCSF Alliance Health Project. I do training and curriculum writing, and we currently are incorporating Hep C into our HIV test counselor training.
Great.
Randy Crump, Florida Department of Health's Hepatitis Prevention Program in Bartow, Florida.
Great. Welcome.
Connor Bridge, Florida Department of Health in Seminole County with Enid Santiago and Sarah Connolly.
I'm Kathy York. I'm a communicable disease nurse with the Orange County Health Department in Chapel Hill, North Carolina.
Good full.
I am Sandra Clark. I work in marketing and communications for Desert AIDS Project in Palm Springs, California.
Welcome, Sandra. The chat box we have Miranda McCrae in New Haven, Connecticut with Cornell Scott Hill Health Center. And she's an HIV outreach case manager. We also have Angel Hernandez in Puerto Rico, volunteer with various AIDS service organizations, and Leticia Aguilera, Desert AIDS Project. Ty Kaiser in New Orleans, Odyssey House, Louisiana, and she's a case manager. Anyone else? Oh, and again, feel free to type it in or just chat it out over the phone. We have Jose de la Cruz Desert AIDS Project. So, New York City Network, HIV Program Associate.
Palm Springs.
Let's see, Houston Department of Health and Human Services.
Luz Lopez, Springfield, Mass., HIV and STI Health Educator.
Great, welcome.
Thank you.
We have your name.
It sounds like the lines are somewhat kind of going died down, but as you can tell, when we have the lines unmuted, some of the background noise can be a little disruptive, which is why we kind of try to tend to keep the lines muted throughout the webinar. But like I said earlier, if at any point you want to pose a question or make a comment, you can do so by unmuting your line, and you can do that by pressing *7. So the key link there is *7 to unmute your line, and then you can mute it again by pressing *6. So what I'm going to do now is I'm going to go ahead and mute the lines again, just to eliminate that background noise.
The conference has been muted.
So moving forward, I kind of want to give you guys a sense of who we are in case you don't know or have heard of the Latino Commission on AIDS. But the Latino Commission on AIDS is an organization that was founded back in 1990 to address HIV/AIDS in the Latino communities nationwide. We've provided services in 40 states, including Puerto Rico and the Virgin Islands. We do have a multidisciplinary staff, so not all of us have a history in public health, but we do have a strong passion for it and have definitely developed our skill set from psychologists to business people from very different backgrounds that have really come together to address health disparities in the Latino community with the focus on HIV and AIDS. We're a multicultural, multi-agency, multilingual, multicultural agency, meaning that not all our staff are Latinos or Hispanic, which I think we're very proud of the fact that we're providing things like capacity building assistance. We provide those services to organizations that might not solely work with Latinos. So we do provide capacity building assistance, and we work with community-based organizations funded by the CDC, so we do provide that service for free, no matter what their target population is. So it's not racially or ethnically based. We were spearheaded by late advocate Dennis DeLeon, who during his time as president at the commission passed away, and he was succeeded by Guillermo Chacon, who's our current president now. Both who have been strong advocates and leaders in community mobilization and really driving the force behind making sure that health disparities amongst Latinos are narrowed nationally, locally, and regionally. With that said, the Commission has 5 core areas. We do a lot of research, so a lot of what we implement is very much research-based. A lot of that research is done internally. So we want to make sure that whatever we are executing, implementing, and planning and promoting is done in an effective way, and we do this by making sure it's evaluated. We also provide local services to the community at large, so we do offer programs, interventions locally, do HIV and HCV testing and linkage to care, and like NHAD and NLAD do, we do mobilize communities at large. One of our largest programs here, in the program under which NLAD and NHAD are kind of housed under, is the Capacity Building Assistance Division. And the Capacity Building Assistance Division is a program that's funded by the Centers for Disease Control to assist organizations to function better ultimately. So we do provide capacity building assistance completely free of charge to the organizations that we work with. And that could be any type of training or assistance around how to implement a program better, how to recruit certain target populations, how to enhance or adapt programs that are being implemented. Those are all types of services that we could provide under capacity building assistance. So again, we do work locally, regionally, and nationally. And we really pride ourselves on the fact that we do the work of agencies that we partner with also, which really, I think, says a lot as far as putting ourselves in the place of the organizations that are doing the work locally. It really resonates with us and also our partners to be able to relate to each other like that. So what is National Hispanic Hepatitis Awareness Day? Ultimately, and I've kind of addressed this way so far, it's very much community mobilization driven, meaning that it's a collective of partners that have an ultimate goal of drawing attention to the critical role viral hepatitis testing, prevention, care, and treatment plays in addressing this epidemic. And in a minute, I'll address kind of what hepatitis looks like in the Hispanic community and why it's such a dire need for us to raise awareness and have a date like National Hispanic Hepatitis Awareness Day to commemorate and also heighten awareness around what's going on with Hispanics and hepatitis. This is a national campaign that is implemented at a local level, and I think that really speaks to the way in which we mobilize on a national scale. It's really important to me to be able to resonate, as a unified voice nationally, but also have a strong connection to communities locally. And the way in which we do this is kind of provide that platform for our partners to speak to one another, communicate, and network to make sure that we're all on the same page and be able to understand what's going on within our own communities locally to be able to support one another and reaching awareness around hepatitis. And again, this is something that this is a campaign that was developed by the Latino Commission on AIDS to do just that, to raise awareness around hepatitis and understanding that we need to do this as a collective to make sure that the ultimate change in awareness is most effective through that. So the purpose of NHAD is a social marketing campaign, and it's implemented every May 15th. This is going to be the third annual implementation of National Hispanic Hepatitis Awareness Day, and it's been a great success so far, and we hope to see that success thrive and continue here on out, being that there is such a dire need to raise awareness around hepatitis in Latino communities. So to kind of give a very macro understanding of what social marketing is, oftentimes when we say social marketing, people think ultimately has to do something with Facebook or Twitter or Instagram or something like that. But really, in reality, social marketing, what it is that we're trying to change the behaviors of a particular population. So we identify a behavior that needs to be addressed or changed, and this behavior can be heightened awareness, or it could be a very specific behavior change like harm reduction, given to a specific population, right? And ultimately the goal is to improve the personal well-being of that particular segment of that population. It is definitely a very much well thought out and planned process to influence this change, and this change doesn't happen overnight. So the fact that we can provide some sort of platform and really mobilize with one another to make sure that we address this disparity around Hispanics and hepatitis really requires a village, right? It really does require a large-scale mobilization effort on our partners' parts, and our part in our collaboration to make sure that we see that heightened awareness. So in summary, NHAD is a community mobilization campaign. So it's a combination of social marketing, and it's also with community mobilization, in that we see those two things work hand in hand. And they foster a diverse network implemented at the local, regional, and national level, aimed at educating, mobilizing Hispanic and Latino communities to increase their knowledge on the impact of viral hepatitis. So again, this is work that needs to be done at these various levels, at a national level, at a regional level, and at a local level, to really be able to implement and see this heightened awareness that we ultimately want to see happen. And the way in which we identify community mobilization is it's a capacity building process through which community individuals, groups, and organizations plan, carry out, evaluate activities on a participatory and sustained basis to achieve agreed upon a goal, either on their own initiative or stimulated by others. And this is a fancy way of kind of saying that the way in which we see community mobilization is that we work with partners locally, develop skill sets, and kind of unify ourselves on a similar platform, and then kind of take a back seat and let that kind of carry out on its own. So we do very much have a supportive network of one another, make sure that we really do address each other's needs and support one another when it comes to implementing this wide-scale mobilization. But we do understand that there needs to be some sort of mutual benefit that needs to be going on in order for there to be buy-in on multiple ends. So NHAD's core elements, and I can't stress this enough, the core element are our partners in the relationships that we build at a national and local level. There really wouldn't be a National Hispanic Hepatitis Awareness Day without the collaboration between our partners and ourselves. So, and again, that happens nationally and locally. What we do is we support and also implementing these events on a national scale, and also support our partners with the development and dissemination of materials like campaign kits and information and webinars and things like this that really raise awareness nationally and support our partners in making sure that they have the information necessary to be able to implement and affect change locally. So our NHAD network partners develops the campaign materials. So we do this with tandem with our partners and make sure that whatever information is needed on their end, we try to integrate in the campaign as much as possible. Communication is key. Again, part of the success of the campaign is making sure that on a national scale we're all on the same page and making sure that we're addressing a heightened awareness around Hispanic hepatitis in a very similar way to be able to affect change. NHAD members are able to use all campaign messages and tailor them as needed to address specific community needs. We understand that the messages and information we provide on a national scale isn't always relevant locally, so we do provide those resources in a way in which they can be adapted to fit those local needs. And again, we provide for any partner that might be interested in materials and trainings in a very customized way, in a very individualized way, to further support your execution implementation of the campaign. So again, we mainly disseminate the information through a website, which is hispanichepatitisday.org. And again, I'll give you guys that link at the end of the day. But the website looks like this, and it's filled with resources and networking opportunities for us to be able to collaborate with one another and across the board nationally to be able to raise this awareness. So I welcome you guys, if you haven't done so already, to visit the website. And before I go into some of the numbers around why Hispanics are being really impacted by hepatitis and see what those numbers look like, I want to kind of open up the line for questions in case anyone might have any questions. And if you do, you can go ahead and type them into the chat box like we did during the introductions, or you can unmute your line. And again, to unmute your line, you can do that by pressing *7. If you have any questions around the commission or the campaign itself, before we start talking about Hispanics and hepatitis. And again, you can press *7, and if not, we can definitely keep moving.
Hello, my name is Lucinda. I'm from New Mexico, and I just had a question.
Sure.
So when you guys are talking about social
marketing?
Yeah, social marketing, do you guys actually have a written plan on how this is going to happen?
Yeah, the way it's implemented is it's we understand, and I think this will make more sense when we kind of go into what the numbers look like around Hispanics and hepatitis. But we see that there's a general lack of awareness. So the social marketing strategy that we're implementing is the fact that we need to raise awareness around hepatitis. And we do this by partnering with local partners to hold events. These events can look very different. It could be a visual, it could be some sort of testing event, it could be a health fair, and I'll give some more of those ideas at the end. But we provide those tools to our partners to be able to kind of heighten that awareness locally. So yeah, we definitely do have a strategy and those tools available through the campaign kit, which you should be able to access online through the website.
Thank you.
No problem. Great. So that was a great question. Again, if at any point anyone has any questions, don't hesitate to jump in and ask one throughout the course of the webinar by pressing *7, or you can enter it in the chat box. So why is it important to educate and mobilize around hepatitis? So for those of us that haven't seen numbers around Latinos and Hispanics and hepatitis, I think it'll become very, very obvious as to why this is a dire need. Chronic liver disease is the third highest cause of death amongst Latinos between the ages of 45 to 64, while it's the 12th in other groups, meaning that we're seeing it impact Latinos more than it does with other groups. It's the third highest cause of death amongst Latinos, when it's usually 12 around other groups, other ethnic groups. Among all ethnic groups in 2009, Hispanics had the second highest incidence of hepatitis A. Hispanics are twice as likely to be diagnosed with hepatitis A than non-Hispanic whites. Hispanic adults 40 years and over are 30% more likely to develop hepatitis B as compared to non-whites. As compared to whites, I'm sorry. Hispanics are 40% increased risk of being infected with hepatitis C than the general population. So these numbers are pretty alarming, and we start to see really what's going on as far as how heavily impacted Hispanics are when it comes to viral hepatitis. For those of us that aren't familiar with what hepatitis is, what I've done here is I've included a video in the next section, and it's really going to give you a better idea of what hepatitis is, some of the differences between hepatitis A, B, C, D, and E, and how they're contracted. And it's a short 4-minute video, but I think it really does a good comprehensive job of explaining hepatitis and kind of the way it's kind of transmitted amongst different types of viruses. So here we go. It's loading the video now.
Viral hepatitis is an inflammation of the liver caused by a virus. There are at least 5 known types which exhibit similar symptoms but are spread in different ways. While symptoms can indicate the presence of hepatitis, a blood test remains the only way to diagnose it and to identify its type. The elderly and people who suffer from liver disease have a higher risk of developing a fatal hepatitis infection. People infected with hepatitis virus should not consume alcohol. The hepatitis A virus is excreted in human feces and is contracted orally through physical contact by eating raw or undercooked food, especially fruits, vegetables, and shellfish, or by drinking contaminated water. Generally, people infected by hepatitis A experience flu-like symptoms. Symptoms usually disappear within 2 months, and the person has developed an immunity to the virus for life. Infected individuals are contagious until 1 week after the onset of jaundice. Hepatitis E is similar to hepatitis A, as it's transmitted via the digestive system and heals on its own, with 2 exceptions. This infection is found mainly in the Indian subcontinent and can be fatal to pregnant women. Hepatitis type A and E heals on their own. To avoid spreading hepatitis type A and E, you should wash your hands thoroughly and regularly. To avoid contracting hepatitis types A and E, you should avoid oral anal sexual contact, and if you're in a region prone to hepatitis, avoid consuming water or any product that has been in contact with water. If needed, an effective vaccine is available against hepatitis A. Hepatitis B is transmitted through unprotected sexual intercourse, sharing contaminated needles, or contact with contaminated blood or bodily fluids. Hepatitis type C is generally transmitted via the blood, sharing contaminated needles, blood transfusions, tattooing or piercing, but can also be sexually transmitted. Many people infected with hepatitis B or C never feel ill and will eliminate the virus completely. If symptoms appear, they resemble those of hepatitis A. However, some people can develop a chronic infection that leads to cirrhosis or the cancer of the liver. People who are HIV positive have a greater risk of developing cirrhosis of the liver if they're infected by the hepatitis B or C virus. Studies have shown that it's possible to transmit the virus to the newborn. Doctors usually do a test for hepatitis B on all pregnant women at the beginning of the pregnancy and prepare a treatment plan if the results are positive. Depending on the patient, they also test other forms of hepatitis if required. Hepatitis D is transmitted the same way as hepatitis B. It also develops only in the presence of hepatitis B and exhibits similar symptoms. Today, medications are available to treat chronic hepatitis B. However, these treatments are not recommended for everyone and they do not eliminate the virus completely, but they can reduce damage to the liver. Even if you do not need treatment, it's important to see a hepatologist, a doctor specialized in the liver, or another doctor who is experienced in hepatitis B. For chronic hepatitis type C, a course of antiviral medication for a period of 6 to 12 months appears to be effective. Up to 50% of patients recover from the infection. To avoid spreading or contracting hepatitis B, C, or D, you need to use a condom and never share your needles or personal items that can contain traces of blood, such as your toothbrush or razor. You should also keep open wounds or sores covered, disinfect any surface contaminated with blood, as well as never donate blood, organs, or sperm. If you have been exposed to the virus of hepatitis B for less than a week, you can receive immunoglobulin therapy. In addition, vaccination is available against hepatitis B. In all cases, we strongly recommend vaccination against hepatitis B. Talk to your doctor, as hepatitis B vaccination programs are available at no charge. Regrettably, there is no vaccine against hepatitis C.
So as you can see, I mean, ultimately what hepatitis is, like she mentioned in the video, is an inflammation of the liver. When we talk about viral hepatitis, this is caused by a virus, and there's different types of viruses, right? Some of them of which we've already received immunizations for, so they're less common. Like she mentioned in the video, it's A and B. But there are some that there isn't an immunization for, which is C, right? So this is a type of a virus that in certain cases, depending on the genotype, can be treated. So it's important for us to part of heightening this awareness is to be able to make sure that Hispanics are being tested for hepatitis, to make sure if there is some sort of inflammation of the liver and it's attached to a virus or it's viral hepatitis, to find out what type of virus it is, and ultimately find some potential treatment that would then alleviate or thereafter make it a chronic condition or just eliminate it altogether. So Latinos are infected at a younger age when compared to Caucasians and African Americans, regardless of medical coverage. And I think this is a big point and something that we start seeing in terms of cultural nuances when it comes to Latinos and Hispanics. Regardless of medical coverage, Hispanic C-infected Latinos are not being treated, right? So a lot of times we don't see Latinos come into the doctor until they're at very late stages and really developed severe liver damage when it comes to inflammation and hepatitis. Hispanics, Latinos progress to fibrosis and cirrhosis, liver scarring faster than any other group, and Hispanics are twice as likely to die from viral hepatitis as compared to whites. So there's an obvious need to heighten awareness around hepatitis within our Hispanic and Latino communities. To kind of put this visually, I put up some pie charts here. The first one at the top here identifies the reported chronic hepatitis C infection in 2010. As we can see, the majority of them, which makes sense considering the size of the population of any virus in terms of eliminate disparities should kind of, or disease, should generally mirror the population and the demographics nationally at large, right? So we see that even though Hispanics play a smaller role as far as having hepatitis C, they definitely play a larger role when it comes to death rates, right? So we can already see the disparities happening here between these two. This chart here being the death rates for viral hepatitis in 2009. This one here shows hepatitis B infection in 2010, and we see Hispanics here having a smaller percentage of that. But again, the rates in which Hispanics are being diagnosed compared to the case in which they're dying, which oftentimes can be treated so it doesn't lead to death, it isn't happening. Latinos in Manhattan alone, hospitalized rates amongst Latinos for hepatitis C is twice that of the national average. In the New York metropolitan area, ranked #1 hepatitis C infections. So, and that's kind of just to put the perspective of what's in a general urban hub when it comes to Latinos. Another interesting thing here to notice is in Puerto Rico, hepatitis C prevalence is ridiculously higher compared to what we see in San Juan specifically than what's going on in the U.S. and worldwide. And there can be plenty of assumptions that as to why that's happening. Oftentimes, what we think is going on is the fact that this has to do with higher intravenous drug use, which is more common, as we see also with co-infection with HIV in places like Puerto Rico and San Juan, and also at large. So we know that hepatitis is affecting our community in a very particular and heightened way. And the way in which we try to address this at a national level is, again, through the partnerships and collaboration that we hope to see not only on May 15th, but throughout the year for National Hispanic Hepatitis Awareness Day. And again, we do see our collaboration and partnership as a fruitful way in which we can really address the way hepatitis is impacting Hispanics. What you see on the slide here is 10 ways in which, examples I would like to think, of ways in which you can participate in National Hispanic Hepatitis Awareness Day. You can contact a local organization to see if there's a planned event in your area and collaborate with them. Hold a special testing event at your agency. Do a phone-a-thon. Call your local representative, and making sure that they understand what's going on with Hispanics and hepatitis, so that they can put it on their platform as something to address. Organize a health fair. Do outreach to the local neighborhoods and promote heightened awareness around the Hispanic Latino community around hepatitis. Gather your friends and family and just have a very candid conversation around how hepatitis is transmitted, how it can be treated, and really have a dialogue around what's putting our family and friends at risk. Host a cultural event and invite a guest speaker, or hold a vigil where you kind of commemorate or remember those that we've lost to hepatitis. Hold a fundraiser and raise money for a charity that addresses hepatitis among Hispanic and Latino communities. And maybe even plan an information session for providers. And your providers can be, doctors or whatnot, or other agencies locally that could really benefit from understanding what's going on with Hispanics and hepatitis, to raise that awareness, especially when it comes to situations where we see that there's a large situation of co-infection with HIV and hepatitis. And again, these are just examples. As far as who our partners have been in the past, it's been anyone from a student group to church groups to organized agencies that already have programs internally to address hepatitis. So we do open up our partnerships to collaborate across the board with traditional and non-traditional partners to make sure that we address this in a very strategic way, to make sure that we're engaging partners that have direct ties and really have investment in addressing a heightened awareness around hepatitis in our Hispanic communities. As a follow-up to this webinar, we will be having a more in-depth conversation around what hepatitis is, how it's transmitted, how it's treated, and how it's prevented. And that's going to be led by Carlos Maldonado, who's our Treatment Now expert here at the Commission. And then we'll also have a follow-up on May 6th, where we talk about the future of hepatitis and kind of the medical advancements that we've seen recently, especially after there's been major groundbreaking treatments that have come about that really will change the way in which hepatitis is treated and prevented. So again, those will be taking place, and you should be getting information about them once we get closer to those dates on April 22nd and May 6th. And on the actual date of National Hispanic Hepatitis Awareness Day, May 15th, we'll be hosting a live webcast panel where we'll be inviting experts to discuss and also have some sort of media, social media interaction with that to raise awareness on hepatitis in our Hispanic communities. So with that said, again, a lot of the information that I've presented today, a lot of the resources that we've pulled information from here to present has been found in our campaign kit. And the campaign kit has a lot of fact sheets around, how hepatitis has impacted Latinos, some of the numbers I've given in a more visually pleasing way to better help you implement and plan your potential National Hispanic Hepatitis Awareness Day event. So there's definitely a lot of resources that we have available for you to utilize to support. And again, not only that, but I'm also here in any way I can to potentially support your endeavors in implementing National Hispanic Hepatitis Awareness Day locally. With that said, I'm going to quickly unmute all the lines now in case anyone wants to pose any questions or make any comments, okay? So I'm going to unmute the lines now.
The conference has been unmuted.
So does anyone have any questions or comments? I see that Javier Ortega asked, any resources for confirmatory testing? Our county won't pay for it. Again, one of the benefits of working together in tandem is trying to pull those resources together, or maybe Javier, we can potentially try to support you in reaching out to your county and maybe support and making sure that that's something they can cover. So again, these are all things that we're all here to support one another on, to make sure we try to address in the best way possible.
This is Lucinda again. I have a question about the video that you showed. I didn't get to see it, but can you send me the link so I could show it to our patients?
Yeah, what I'll do is we're recording the webinar now, so you should be able to view the slides along with the audio once we download it and upload it to YouTube. We'll go ahead and send it out to everyone that's joined us, and I'll send it out to the partners that won't be able to make it, so you should be able to view it there.
Okay, thanks.
No problem.
Yes, hello?
Yes?
Yes, this is Courtney with Real Talk. I just wanted to add in, we have a new program called Bareback Assertive Risk Reduction Education, and it is a STD HIV prevention one-on-one project with high-risk young men of color, which includes Hispanics. We conducted a survey over the last year or so with the highest risk MSMs. We're using the protocol-based counseling state of Texas intervention, and what we found, and I could actually send that to you directly, but what we found was a significant increase of Hispanic MSMs who are actively engaging in unprotected sex. That's pretty much what our intervention does, is we work directly with individuals who who engage in unprotected sex. We work closely with the Impact Houston, who they do a lot of marketing with hepatitis C and HIV/STD numbers. What we found among co-infections among POWHA was a 57.8% listed hepatitis C increase in our study. So that's alarming.
And I commend you, Courtney, for doing that study, because again, part of what we're seeing here is that there oftentimes isn't a lot of research where Hispanics and Latinos are being included to really find out what's going on. So I commend you for doing that research, and please do send me that. I would love to read it and look into it myself.
Absolutely, and it's not just something I just came up with working with Dr. Michael Ross, who is a head researcher who come up with several interventions. He works at UT Houston, and we did, as far as high-risk behavior, we did find Hispanics at 27% identified as Hispanics versus 45% identified as African American, that is two different numbers, but that's still high considered, we can still consider that high risk for individuals who participate in unprotected sex. So that was my piece to, getting involved in this. So in any way that our program can continue to give you data or, help increase that, you can do that. And you guys can also visit our website at www.realtalkproject.com for community information.
Well, thanks for sharing that.
Thank you.
And Leticia just asked in the chat box, do we provide pamphlets and referrals while working in the community? We do have pamphlets, and all this information can be found in the campaign kit, which you can download and access online. So we have those so you can go ahead and use them and adapt them in any which way you want, and include your organization's information on there to kind of share with your local communities as well. So I really do encourage you all to go to the website and access that information, because there's been a lot of work that's been put into developing that.
Sure.
Else? That's it for now. That's completely fine. We definitely want to maintain the conversation going and keep the dialogue going and making sure that we support each other and really implementing an effective National Hispanic Hepatitis Awareness Day that happens every May 15th. And it's about a month away, so I think we definitely have potential to collaborate with one another and support one another in making sure that we have some sort of heightened awareness around hepatitis in our Hispanic Latino communities. I've included the link to our website here. You can see it. It's www.hispanichepatitisday.org. I've also included my email information. It's tochoa@latinoaids.org, and also our direct numbers and address there listed. If you haven't done so already, I really recommend you following us on Twitter. We put most of our information out there first before anyone else, and I think that'd be a great way for us to maintain dialogue and also generally just heighten awareness around social media as well. So. Like I said, if there's anything else, please don't hesitate to contact me directly. And I look forward to talking to a lot of you. So please stay in touch, and we'll be in communication. All right?
Sounds great.
Here.
Thank you.
Bye.
Gracias. Thank you.
Bye-bye.